My name is Jennifer Dunphy, and I work for a company called Get Real Health, and we're here at HIMSS today in the Interoperability Showcase to show how easy it is to send your medical record from one place to another securely. What we do is we have a product called Instant PHR, and that's a patient health record. And what we're doing today is talking about a woman named Jenn Smith, and we're showing her cycle of her health. She has struggled with a weight problem her whole life, and she's used the Instant PHR as her patient health record through her general practitioner to help monitor her weight and try to keep her healthy, show her how to eat and how to exercise right. And she became pregnant, and she developed gestational diabetes and hypertension. So she was then able to use the tool to help keep her diabetes under control and to help her stay within a good weight range during her pregnancy. Jenn was able to do this through using some incredible connected devices. And what our system does is it allows providers and patients to assign action plans, which consist of goals and tasks. And the physicians can prescribe or assign clinical action plans, like a gestational diabetes plan, which helps Jenn stay healthy during her pregnancy. And a patient can assign themselves a wellness plan to help herself exercise or eat better during her pregnancy. So our action plans have goals, and below the goals there are tasks, and you have to complete a certain number of tasks in order to reach your goal. So for Jenn, there are certain things that she has to do that are very infrequent, like see her dietitian once a month or check her hemoglobin A1C every 3 months. So those things are very easy for patients to enter on their own. They can go into the system and enter them. But there are more repetitive tasks, like checking your blood sugar 4 times a day, that place a burden on patients. And it really keeps patients from comfortably engaging in their health care and entering that data to help themselves get healthy. We are connected to over 200 different medical devices that can help feed that data into our system. We have a Wi-Fi enabled scale, we have cellular blood glucose glucometers that can feed that information into our system. And we can ingest and absorb information from multiple different sources. We can take CCDAs from discharges from hospital stays or from physicians' office visits. We can also take information from these devices that's automatically uploaded into the system, or the patients can enter the information themselves. And all of this information is sourced in the product. So it says that it either came from City Hospital, or that it was entered by Jenn herself, or that it was entered through a device. The other thing is that all of this information that comes in through the medical records is then parsed into our system. So if a patient gets a discharge summary from a hospital and say she has 5 new medications, this keeps her from having to sit and enter everything. It goes automatically into the medication record, shows her how to take it and when to take it, and it really helps decrease any errors in data entry, which can create such a problem with taking medications. So what we're showing today is Jenn's story. And Jenn, in her 35th week of pregnancy, was in a car accident and ended up in an emergency room. And when a patient presents in an emergency room, they're generally not in a position to be able to sit and tell everybody their medical history, and sometimes they're just not able to at all. So using a system like this where all of her medical information is together, her information from her hospital systems, from her devices, and all the information that she's generated herself is all together in one place. So that when she walks into a setting like an emergency room, she can give all of that information over to the hospital. And that can be done in a couple different ways. We have both a patient-facing side and a provider-facing side. So very easily, Jenn can go into the system and send her medical record to the hospital. But also she could have a designated family member do it for her, or her provider could send that to the hospital. And it's all done securely, so the patients know that all of their medical information is secure and that they are the people who are truly in control of their care. And that's what we're showing here in the Interoperability Suite today.